Ever felt stuck despite doing everything right with sickle cell? If you've asked yourself this question, you're not alone. I asked myself this for years until I discovered a painful truth. Our medical system merely prevents death rather than promotes quality of life. I remember breaking down after my third crisis in a month, following every doctor's order perfectly. The revelation hit me hard. Standard care only addresses about 40% of what impacts your daily life. The other 60%, that's on us to figure out. Today, I'm sharing the complete system I built. The difference between merely surviving and actually thriving with sickle cell. Ever wonder why you still have pain and fatigue even when you take every medication exactly as prescribed? The truth is shocking. Standard medical care was never designed to handle everything sickle cell throws at us. Look, I've been there. Taking hydroxyurea, drinking gallons of water, avoiding the cold, and still ending up in the emergency room, wondering what went wrong. After years of following every rule in the book, I realized something important. Our medical system excels at handling crises, not preventing them. Doctor visits focus on your blood counts, medication adherence, and current symptoms, but completely miss what happens between appointments. Standard care is essentially a safety net with huge holes in it. You get about 15-20 minutes with your hematologist every few months. In that tiny window, they're supposed to address your entire experience with a complex condition that affects every system in your body. It's like trying to fix a car's engine through a keyhole. Medical professionals aren't being dishonest. They're trained to treat the disease, not your whole life with the disease. They focus on preventing sickling and managing pain, leaving massive gaps in your daily quality of life. When was the last time your doctor spent more than a minute discussing how temperature changes affect your specific body, or how your stress at work triggers more frequent pain, or how certain foods might worsen your fatigue? Studies confirm this problem. Patients relying solely on standard medical care report significantly lower quality of life scores compared to those using complementary approaches. This makes perfect sense when you consider that standard protocols were developed for an average patient, but with sickle cell, there is no average. Your triggers, pain patterns, and response to medications are as unique as your fingerprint. The medical system's approach remains fundamentally reactive rather than preventive. It waits for problems instead of building your resistance to them. It addresses the crisis but misses the environmental factors that make up our daily struggle. So, what happens when we start looking at our health as a complete system rather than just a collection of symptoms to manage? That's where the real transformation begins. What if I told you that while medical science has been studying sickle cell for over a century, some of the most powerful tools for managing this condition aren't found in prescription bottles or hospital rooms? The medical system gives you a safety net, but what you really need is a springboard. When I discovered these 4 interconnected pillars of health management, my hospital visits dropped significantly within a year, not because I stopped following medical advice, but because I finally addressed the massive gaps my doctors never had time to fill. I felt like I was swimming against a powerful current every day until these pillars became my life raft. Holistic health, seasonal adaptation, nutrition optimization, and stress management transformed my life by creating a complete health system tailored to my unique body. Here's the thing about becoming your own health detective. Nobody taught us how to do this. In school, we learned about cells and organs, but never about how to listen to our bodies or connect different aspects of our health. The holistic health pillar recognizes that physical symptoms don't exist in isolation. That pain in your joints might spike when you're anxious or sleep deprived. During a particularly stressful week, my pain levels were unbearable until I tried meditation. At Children's National Hospital, they've created a program integrating psychology, acupuncture, and mindfulness to help patients manage pain beyond medication. Just as our bodies respond to inner rhythms, they also react to nature's cycles. The seasonal pillar is critical for sickle cell management. Our bodies are sensitive to environmental changes. You can prepare for summer by gradually increasing hydration weeks before temperatures rise, or take specific supplements during winter to help adapt to the cold. For example, vitamin B complex can help boost energy levels, which can drop due to shorter days and less sunlight. Nutrition goes beyond eat healthy advice. For sickle cell patients, foods like whole lemons, including the seeds and skin, not just the juice, are anti-inflammatory, while leafy greens support healthy red blood cell production. But foods healthy for others might trigger symptoms in your body, making careful tracking invaluable. Having a healthy gut is integral to good nutrition. Without healthy gut bacteria, we may not benefit from our food. The stress management pillar requires techniques for your specific response. Research shows that relaxation methods can reduce muscle tension that worsens pain. Some people need meditation, while others process stress through physical activity. Those stress management techniques might feel like tools locked behind a glass case, powerful when you can access them, but what about when you're too exhausted to even try? Let's be honest. Research indicates 78% of patients abandon new health strategies within the first week, not because they don't work, but because implementing anything new when you're already managing sickle cell can feel like climbing a mountain without oxygen. But what if you could start building your personal health system with just 5 minutes a day? I'm not talking about overhauling your entire life overnight. I'm talking about starting so small that it feels almost ridiculous, because that's exactly where sustainable change begins. Let's start with the simplest step, daily tracking. Grab your phone or a small notebook and spend 5 minutes noting your energy level, pain intensity, mood, and potential triggers. Ask yourself, how did the weather affect me today? Did my mood shift after certain foods? You're creating your own personal health database. When you look back after a few weeks, patterns will emerge that no doctor's appointment could ever reveal. Next, embrace the power of tiny experiments. Instead of trying to change everything at once, pick just one approach from any of the 4 pillars and commit to it for only 3 days. Maybe it's drinking an extra glass of water each morning, or trying a 5-minute meditation before bed. 3 days is short enough to feel manageable, but long enough to notice how your body responds. Once you've mastered a tiny experiment, technology and a support team can amplify your results. There are symptom tracking apps such as Bearable, Flare Down, and Chronic Insights, specifically designed for chronic conditions that do the pattern recognition for you. Your health team extends beyond doctors to include nutritionists who understand sickle cell dietary needs, mental health professionals, and community support groups where people truly get what you're going through. When meeting with medical professionals, share your personal system findings with confidence. Instead of vague descriptions, be specific. I've noticed when I eat these foods and practice these relaxation techniques, my pain decreases by about 30%. This transforms the relationship from transactional to partnership. Remember, this approach isn't about replacing standard medical care, it's about complementing it with strategies that address the whole you. Patients who successfully integrate these approaches often report improvements not just in physical symptoms, but in emotional and psychological well-being too. Imagine a life where every step forward is a victory against a system that tells you to just survive. Your healthcare journey extends far beyond those brief medical appointments. That recent study I came across showed something powerful. Patients taking an active role through holistic approaches experience significantly better quality of life, building resilience. This is about progress, not perfection. Each small step you take, tracking a symptom pattern or trying a stress reduction technique, moves you forward. Research shows these approaches enhance self-efficacy and coping mechanisms, creating better health outcomes. You deserve to wake up feeling empowered rather than at the mercy of your condition. By combining medical care with your personalized health system, you're not just surviving with sickle cell, you're the architect of your own vibrant life.